Assalamu alaikum dear students. Welcome to Dr. Roomi lectures. Today we are going to study a very important topic from endocrine physiology, which is the physiology of thyroid hormones. Thyroid gland is one of the largest endocrine glands in our body. Its weight is about 15 to 20 grams in adults. Thyroid hormones T3 and T4 are essential for growth, maturation and metabolism in mammals. Thyroid hormones are major anabolic hormones. Thyroid gland is located in the lower part of neck just below larynx. It has two lobes, one on each side, which are connected together by an isthmus. The shape of thyroid gland is like that of bow tie, and it's also located at the same place where we wear a bow tie. The functional unit of thyroid gland is thyroid follicle. In this diagram, you are able to see five thyroid follicles. Each thyroid follicle is 100 to 300 micrometers in diameter. Normally, each thyroid follicle is lined by a simple cuboidal epithelium, which means that these cells are cube-like in shape and their nucleus is centrally present. However, the shape of these cubical cells, it can change in under and overactivity of thyroid gland, which depends upon its stimulation by the thyroid stimulating hormone. When there is overstimulation of thyroid gland by increased activity of TSH hormone, then these cells may become columnar, and in case of underactivity of the thyroid gland because of decreased secretion of TSH hormone, there may be flat cells. The lumen of thyroid follicles is filled with a colloid material which contains a large protein molecule thyroglobulin, which is synthesized by the thyroid follicular cells and then secreted through the microvilli into the follicular lumen. Iodide is uptaken at the basal and lateral membranes of the thyroid follicular cells. Oxidation, organification, and coupling reactions in the thyroid hormone synthesis take place at the apical border of the thyroid follicular cells. Parafollicular cells or C cells are present outside of thyroid follicles and do not border on the thyroid follicular lumen. C cells release calcitonin hormone, which is important in calcium metabolism. Just like other endocrine glands, thyroid gland is having very rich blood supply. Thyroid gland is just second to adrenal gland in terms of its rich vascularity, which means adrenal gland is highest in its vascularity, followed by the vascularity of thyroid gland. And the blood flow in thyroid gland per minute is 5 times its weight. If its weight is 20 grams in adults, then per minute it has a blood supply of about 100 ml. So these glands like thyroid gland and adrenal gland, which are very rich in their blood supplies, they have surgical implications because there may be severe risk of bleeding during operation or after operation in case of thyroid and adrenal gland surgeries. Let's study the synthesis of thyroid hormones. In order to explain it, I have drawn a very simple diagram to illustrate various steps of thyroid hormone synthesis. Almost every step in the synthesis of thyroid hormones is stimulated by a thyroid stimulating hormone or TSH, which is a hormone coming from the anterior pituitary. First step in the synthesis of thyroid hormones is the active uptake of iodide ions from our plasma. This is done by a pump called as iodide pump or sodium iodide co-transporter, which actively pumps iodide from the plasma into the thyroid follicular cells. Normally, the ratio between concentration of iodide in the thyroid gland and in the blood plasma is 30 to 1, which in case of hyperactivity of thyroid can be more than 200. The iodide which is trapped into the cell is thrown into the thyroid follicular lumen by using a carrier called as pendrin located at the apical cell membrane of the thyroid follicular cells. This exchanges iodide with chloride. Sometimes when we have to assess the functional status of thyroid gland, we give a measured dose of radioactive iodide. Normally, 10 to 35% of the given dose of radioactive iodide is uptaken by the thyroid follicular cells within 24 hours. And this is a very useful index of the functional status of thyroid gland. This iodide pump, which is located on the basal and lateral surface of the thyroid follicular cells, can be inhibited by thiocyanate and perchlorate anions. And by decreasing the uptake of iodide, these anions, thiocyanate and perchlorate, can decrease the synthesis of thyroid hormones, leading to decreased function of the thyroid gland. Thyroglobulin is a large glycoprotein molecule which is synthesized by the ribosomes, then glycosylated by the endoplasmic reticulum, and then packaged by the Golgi apparatus into vesicles. These vesicles are thrown into the thyroid follicular lumen into the colloid material. Thyroglobulin is very rich in tyrosine amino acids. Each molecule of thyroglobulin contains about 70 molecules of tyrosine. Thyroglobulin is the major constituent of the colloid material in the thyroid follicular lumen. The iodination of tyrosine residues within thyroglobulin molecule leads to formation of thyroid hormones. Next step in the synthesis of thyroid hormones is conversion of this iodide into iodine, which is the active or reactive form of iodide. In this reaction, peroxidase or thyroid peroxidase is an essential enzyme. This enzyme, in the presence of hydrogen peroxide, performs this reaction. Some other active forms of iodide which are formed are free radical of iodine, iodinium, and nascent iodine. All these forms, including iodine, which is the most abundant form, are all active forms of iodide which can react with tyrosine residues within the thyroglobulin to form thyroid hormones. Oxidation is the first essential step in the synthesis of thyroid hormones. The uptake of iodide is not an essential step because iodide can also come from inside of the thyroid follicular cells by the recycling of iodide containing amino acids which are MIT and DIT. The oxidation reaction occurs at the apical membrane of thyroid follicular cells in the presence of peroxidase enzyme. Peroxidase enzyme can be inhibited by drugs like propyl thiouracil, and these drugs can be used for the treatment of hyperthyroidism because this drug decreases the function of thyroid gland. The next step in the synthesis of thyroid hormones is addition of active iodide with tyrosine residues inside thyroglobulin, which is substrate for iodination. During iodination or organification reaction, there is formation of MIT and DIT, which are monoiodotyrosine, formed when one atom of iodine attaches with a tyrosine residue. DIT is diiodotyrosine, formed when two atoms of iodine attach with one molecule of tyrosine. MIT and DIT are functionally inactive because they cannot perform their function like T3 and T4 hormones. When high levels of iodides are present in our blood and in thyroid gland, this can suppress this iodination reaction, and this is called as Wolff-Chaikoff effect. By decreasing the synthesis of thyroid hormones, this decreases the thyroid activity. Next step in the synthesis of thyroid hormones is coupling of monoiodotyrosines and diiodotyrosines. When one molecule of MIT and one molecule of DIT couple with each other, there is formation of a molecule called as T3, a triiodothyronine. And when two molecules of DIT couple with each other, there is formation of T4 or tetraiodothyronine, also called as thyroxine. Unlike MIT and DIT, T3 and T4 hormones are biologically active and can perform their functions. Let's quickly go through the chemistry of thyroid hormones. Thyroid hormones are made from tyrosine amino acid, which is abundantly present within the thyroglobulin molecules. Tyrosine contains benzene ring, which when iodinated it will make T3 and T4 hormones. The presence of benzene ring in tyrosine amino acid makes T3 and T4 hormones lipid soluble. When carbon number 3 of benzene in the tyrosine molecule is iodinated, it makes monoiodotyrosine. When carbon number 3 and 5 of the benzene in tyrosine both are iodinated, it makes DIT or diiodotyrosine. When one molecule of MIT and one molecule of DIT condense together, they make T3 hormone. So in T3 hormone, you can see here carbon number 3 and carbon number 5 of one benzene ring, they are iodinated. In the second benzene ring, only C3 is iodinated. You can call it 3 prime. When in second benzene ring, both carbon number 3 and carbon number 5 are iodinated, but in the first benzene ring, only carbon number 3 is iodinated. This leads to formation of reverse T3, which is functionally inactive. Although it's present in our blood, but functionally it's not active. When both carbon number 3 and 5 in benzene 1 and benzene 2 are iodinated, then this is called as T4 or thyroxine. T3 and T4, they are also called as iodothyronines, triiodothyronine and tetraiodothyronine, and MIT-DIT, they are also called as iodotyrosines, monoiodotyrosine and diiodotyrosine. Please keep in mind MIT-DIT and reverse T3, they are not functionally active. Only T3 and T4 hormone are functionally active. Normally, T4 is 15 to 20 times more than T3 hormone. However, in case of iodine deficiency in our body, this ratio shifts towards T3, which means gradually there is less synthesis of T4 and there is more synthesis of T3. T3 and T4 hormones are stored in the thyroid follicular lumen, and the quantity is enough for up to 2 to 3 months. This is why when there is iodine deficiency in our body, the deficiency of thyroid hormones will not occur quickly within days. Rather, it will take some months to develop. As you know, lipid soluble hormones like steroid hormones cannot be stored inside the cell because they are lipid soluble and they can easily cross the lipid membrane. However, thyroid hormones are exception. These hormones can be stored outside of the cell within the thyroid follicular lumen, within the colloid material. This storage of lipid soluble T3 and T4 hormones is within a large thyroglobulin molecule to which they are covalently bound. T3 and T4 hormones remain stored within thyroid follicular lumen until its release is stimulated by TSH hormone. Release is the next step in the synthesis of thyroid hormones. Release of thyroid hormone begins with the pinocytosis of pieces of colloid material which contains thyroglobulin molecules. So after this endocytosis, these colloid droplets which contain thyroglobulin protein containing T3 and T4 hormones fuse with lysosomes. Lysosomes release their enzymes which are proteases and peptidases. The hydrolytic action of lysosomal enzymes convert thyroglobulin into T3, T4 hormone and reverse T3 which enter into blood circulation passing through the basal membrane and also into monoiodotyrosine, diiodotyrosine and other free amino acids. Normally, much more quantity of T4 hormone is produced than T3 hormone. T4 is about 93% and T3 is just 7%, and the ratio between these two hormones is about 15 to 1. In case of iodide deficiency in our body, there is proportionally more synthesis of T3 hormones as compared to T4 hormone, and this T4 to T3 ratio, which is normally 15 to 1, shifts towards T3 in case of iodide deficiency. Although much more quantity of T4 is secreted than T3, however, T4 hormone is converted into T3 in our peripheral tissues before its action. And this is T3 hormone which is much more active biologically as compared to the action of T4 hormones. Deiodination of MIT and DIT can be done by an enzyme which is called as deiodinase. This iodide released from MIT and DIT is second iodide pool and can be reused for the synthesis of thyroid hormones. In case of deficiency of deiodinase enzyme, we cannot reuse the iodide which is trapped within MIT and DIT. The deficiency of deiodinase enzyme will lead to the symptoms of iodide deficiency and hypothyroidism. So just to summarize, the important steps in synthesis of thyroid hormones are iodide uptake, synthesis and secretion of thyroglobulin protein, oxidation of iodide into iodine to make active form, and then iodination or organification reaction, Coupling reaction, also called as condensation reaction. Then pinocytosis or endocytosis of thyroglobulin, which is present in the colloid material. It's breakdown by the lysosomal enzymes and then release of the T3 and T4 hormones into circulation. Please keep in mind T3, T4, they are biologically active, but reverse T3 is not active. The extra iodide which is trapped in MIT and DIT can be recycled by enzyme deiodinase. Synthesis of thyroid hormones can be decreased by thiocyanate and perchlorate anions, which block the iodide pump, and also by the drugs thioamides like propyl thiouracil, which blocks all the reactions which are performed by peroxidase enzyme. It means propyl thiouracil can block oxidation, iodination, and coupling reaction, and that this can cause decreased function of the thyroid gland. It's very useful treatment for hyperthyroidism. High levels of iodide can also suppress the iodination reaction. This is called as Wolff-Chaikoff effect, and this can decrease the synthesis of thyroid hormones. Deficiency of deiodinase enzyme can also decrease the synthesis of thyroid hormones because this iodide will not be recycled, and this can mimic the symptoms of iodide deficiency. In our next lecture, we will discuss regulation, transport, metabolism, and excretion of thyroid hormones. Thank you so much for watching this video. See you next time with another video.